that suggests things could get much worse. For more on all of this, I am joined by Mayor John Tory. Thank you so much for being with us this morning.
Good morning, Pam.
Phew, I do not envy your position or anybody's position who is in a position of authority like you are and having to make all these decisions. You have to walk a very fine line. Tell us about the restrictions that are kicking in today and what the impact is going to be on our struggling bars and restaurants.
And they are struggling. And I should start off by saying that I think sometimes people comment on Dr. Davila, for example, more so than myself, because she's the one giving the advice, as if nobody thinks about the restaurants and bars and how they're struggling. We spend agonizing hours of time trying to get that balance. I think you used the word balance right, in terms of doing what we think we must do based on her advice. And she's the expert. I mean, she is a doctor and a person who has all kinds of expert doctors around her to give advice. And then we have to sort of look at that in the context of also the broader picture, which is how does it affect employment? And by the way, she constantly, makes reference to the mental well-being and the economic well-being, because she understands that public health in the broadest sense includes, how people are feeling in their own lives who may not be directly affected by COVID, who are not ill, but they may be under great stress because of their business or because their job is at risk. But so today, these changes were announced some time ago, and they'll say now you can only have 6 people as opposed to 10 at a table. And again, all of these recommendations are based on the same thing, which is that you're sort of trying to avoid what I call crowd scenes. So 10 isn't a very big crowd, but it's bigger than 6. And if you have 6 as opposed to 10, it just lessens the chance that there's going to be somebody at that table that's going to have the virus. It reduces from 100 to 75 the number of people who can be in a restaurant. Same principle. The one that sometimes people find a little harder to understand, but I think when they think about it, everybody will know. Now, music under these restrictions is at conversation level only. Why? Well, because when there's loud music, we all know this, that when there's loud music, you lean in closer to the person you're sitting next to. If you want to talk, you talk louder. And those things, as much as it may sound far-fetched, they contribute to the spread of the virus. And we see numbers right now, just so that you know, we see numbers right now that are going in the wrong direction. We have, for example, an average increase in the case count of 214 over the last 7 days. And that is the highest it's been since April. So, whereas what we wanted to have was a curve that was going like that all the way down and staying down, what we have is a curve that went down like that and is now coming back up to levels that we saw in the spring. So I think people, can understand that that is not a good development, and that left unchecked, if you keep it going like that, then it gets back into the long-term care and the seniors and so on, even though right now it's more young people.
And Dr. Davila does predict that things are going to get a lot worse. It's just a terrifying thought. This disease is just so tenacious and pernicious. We can't afford to have this get worse.
No, and the thing is that, but make no mistake, when she puts those charts out, and people can go and look at them. So lest they think that she sort of draws these measures out of a hat, or that she thinks these things up because it's something to do on a Thursday. They do all kinds of scenarios, and there's one scenario when it says it's going to get much worse that contemplates that we do nothing. So if we just let the status quo prevail, that's when the projection is that it gets much worse, by the end of the year. And people say, well, that's a long way away. Well, yes, it is. But do you want to get to the stage where you all of a sudden have the hospitals full? I mean, we saw what happened as close by as New York, when all the hospitals were full and they just sort of lost control of it. So she's saying if we did nothing, that's where you get to with this curve that goes like that. Mm-hmm. But there are ways in which, as we've talked before in the spring about, and we did it in the spring, where we flattened the curve by having less activity. So even with Thanksgiving, when the advice is dine only with the people you live under the same roof with, don't go out unless you have to go out to go to work, to go to school, to exercise, or to get food. Generally, let's quiet things down and do it in a less stringent way than in the spring, but in a way that sort of just generally kind of tones down the activity level and tones down the exposure to crowds. And that is, she believes, and the province will have to make its own decision about this, will contribute to flattening out that curve and not having it go like this and having us in a really bad situation, by later this year.
Really difficult situation for everyone, and it's a very fine line you have to walk. And thank you very much.
But people have done so well, Pam. No, it's no problem. But I will say people have done so well. And if I could just plead with them, I don't plead much because it's not, I don't know, it's not the way you're supposed to be. But I will plead with people to listen to the advice about Thanksgiving. It's hard. Mm-hmm. We're not going to be able to see any of our kids, or we're going to go stand on their sidewalk and wave at them. Seriously, we're not eating dinner with them, and it is one of those occasions every year where we had a great big fun, full of laughs and full of too much turkey and all that. It just can't be done this year because that's going to be, again, the circumstance with kids back to school, for example. They're going to be bringing all the exposures they've had at school to the household of their grandfather or grandmother, and that is something that's dangerous. And so that's why the advice, we're not trying to kill fun or kill Thanksgiving. We're just trying to do something that's going to keep people healthy.
I haven't seen my parents in months. I really miss them. Thanks so much, Mayor.
Exactly. Thanks, Pam. Thank you. Bye-bye now.
Bye-bye. Let's check in with Steph, who has a look at the roads now.
Thank you so much, Pam. Yes, we're taking a look at your roads this morning. I'm on Victoria at Dundas. Things are moving pretty well here. You could say that they're not moving, but not for the wrong reasons because there's not much going on here right now.